Even as we were kind of speaking with some of our employers as we're kind of working, in this collaborative effort to improve care, they were saying that up to 40% of their employees do not even have a primary care physician. And part of the problem there too is, again, it's tough to get anybody to go into primary care. It's, high burnout, it's the lowest paying. You come out of med school with big debt, you're going to choose one of the specialties to assist in paying that off. And like if you look at, population from say 1980 to 2020, our country grew about 41% population wise. We went from, maybe 241,000 or 221,000 to 311,000 or so. In the next 20 years, from 2020 to 2060, it might grow about 10%. But the problem is with that growth, you can't get folks to do primary care. So if you crunch the numbers and you look, there are maybe about 270,000 primary care deliverers on the physician side in the country, about the same number in nurse practitioners, maybe about a tenth of that in physician assistants. But if you look by the year of 2036 with that growth process, and these are going to be folks that are coming in into the employment age, we're going to be 70,000 providers short on the primary care side by the year of 2036. So now those deliverables where we're talking about you can't get in, you can't get access, now it's going to become even worse. And the problem there again is, how do we put satisfaction and that process back into the primary care network to where we can get those providers to be satisfied and employed in that manner? Otherwise, it's a disaster now. It's only going to get worse. I mean, you can look at health outcomes and look at the top 38, industrialized countries in the globe. We're 31, and if you look at maternal care and fetal care, we're worse. It's an absolute disaster, and in the current rate, it's the cost is not tolerable, and the care is not tolerable, and we deserve better, and we need to have a model where it's more effective. You can put a primary care doc in any community. The longevity of that community will improve twice as effective as any other specialist in that community, in the cost-effective manner, from the screening, early detection, mitigation strategies, chronic care, all goes in unison with that, and we just don't have the bodies, and the way the system's designed, it's awfully tough to continue to put them in there.